And we're back. I'm Dr. Yassir Sonbol. Let's dive right back into today's medical conversation. Welcome back to Real Medicine, Real Lives. I'm here with Ross Fahn, founder of Off-Script Consults. And now I want to talk about the place where many healthcare decisions begin, the internet. People search symptoms, they compare medications, they watch videos, they read posts, they scroll through medical wellness claims, medical opinions, patient stories, and sometimes information that sounds confident but is not clinically reliable. Digital health can be powerful but can also be very confusing. The question is not whether people will search for health information. The question is how it will help them interpret the information wisely, safely, and with the right medical guidance. So if you've ever searched for a symptom online and ended up more anxious than informed, this segment's for you. Health information should help people ask better questions, not push them into fear, self-diagnosis, or unsafe decisions. So we're back with Ross Fahn, and we're going to talk with her about as well as medical. She's a medical about her work as a medical writer and reviewer of the focus on digital health publications and medical communications. This segment explores the tension between access and accuracy. Patients have more information than ever, but more information doesn't always mean better and more better understanding. And Ross can help with us unpack how the medical content should be created, reviewed, consumed, and how patients can use online health resources without replacing professional care. The goal is not to shame people for searching. The goal is to help them search smarter, ask better questions, and know when to bring that information back to a qualified healthcare professional. So Ross, thanks for bringing this topic up because I think this is really, really important. And in the digital era, the internet, now artificial intelligence with Chat GPT, and people asking things questions and it just spits out information to them. I tell people all the time, I appreciate Dr. Google, but Dr. Google doesn't have healthcare experience. He's just spitting out information that's put into it. And so when you look at health information online today, what concerns you the most as a pharmacist and as a medical communicator to people?
I'm sure. I think you definitely hinted at some of it. Is misinformation, I think, is my biggest fear. And of course, sources as well, right? Like you said, ChatGPT, all this AI, it spit out all this information. But what I've come to learn when I talk with other users of AI, for example, they rarely ask for the sources of, just say, hey, ChatGPT, please always list the sources you use
Mm-hmm.
when you give me an answer, for example, because they can actually totally do that. And then you can look through the sources, make sure that it's reliable, legitimate. And then you can also try, if you want to go another step further, you can also go in and look if there's any hallucination, right? Any misinterpretation, because we, as well as humans, and we also have
Mm-hmm.
misinterpreted things before. So, yeah, hopefully that answers your question.
And so how can patients tell the difference between content that's actually educational, content that may be misleading or incomplete?
Yeah, just don't take its word for it. The AI's word or anything you look up. I and even with people I talk to these days, I always ask them, where did you find this? Was this Insta news? It's what I always joke about. I'm like, is this Insta science? And then I'm like, okay, not saying that Insta science and Insta news is always incorrect, but did they like list their sources for you? Right?
Mm-hmm.
If you put a comment and ask for their sources, did they respond back where they got this information? And then, so I always go a step further. That's what I always do now when I talk with everyone. I'm like, I need to know your sources. I need to look at it because if it's just something like, how can I say? Um, just a story from someone. I'm not saying that that's always illegitimate. That's like n equals one, right? My science brain kicks in.
Mm-hmm.
That's not enough data for me to create a trend and rely completely that this is factual.
Yeah. No,
Yeah.
I mean it can be really difficult as a healthcare provider who has a foundation of several years of not only clinical experience, book experience, schooling, etc., trying to really explain to people and break it down in a way where they understand it and differentiate between something you read online versus something that's actually used in practical medicine, because not everything that we read online is how we practice or how we implement things. And I think that's I have a patient, God bless his soul, young guy, who just kept coming to me with all the stuff he was reading on Google. And I finally had to one day say, look, if you bring one more thing from Google for me, I'm going to send you to see Dr. Google himself, because I can't answer these questions anymore. And that wasn't trying to be inconsiderate, but it was more of, you kind of run yourself in a loop, and that loop can be dangerous for patients, in my opinion, because they just don't really understand the information. It would be like me going to my lawyer, with a bunch of stuff I read online about how the law works, and that's just not how it happens. So why does medical writing need to be both accurate and understandable for real people?
Like you mentioned with your patient, right? He is using this information to make decisions about his health. If it's not understandable or accurate, we're
Mm-hmm.
pretty much setting them up for failure. That's why I feel like a medical writer, it's a very important responsibility to make sure that we're interpreting our sources correctly. We shouldn't be misinterpreting it or twisting it with our own opinion without having any disclaimer that it is our opinion here.
And so, would you, in your opinion, say it may be better if these medical writers wrote this stuff down in a, what's the word I'm looking for? Maybe a more, simpler form for people to understand. And should there be a lot more disclaimers when people are writing this stuff to say, please, go seek medical advice from a professional without taking this information with a grain of salt?
Yes, I agree with you. I do think that there should be a little disclaimer. I think if you look at my writing, you'll see it at the bottom every time. It's like, please do not make any changes to your medications, your
Mm-hmm.
treatment plan without talking with your clinician team, your clinical team, right? And then I always, that the sources are linked or they're listed at the bottom too, so that then people can verify how I came up with these conclusions. If any assumptions are made because I had to extrapolate anything and it's not all from like the same article, for example, it was two different articles and there's a little bit of, assumptions or extrapolation that's made. I also try to, include that information as well so people knew how I came up with a certain conclusion. But, like you said, with a grain of salt, right?
Yep. And so, what should someone do when online health information seems to conflict, it conflicts with what I tell them or you tell them? What do you advise people to do in that situation?
So I advise them to talk with their provider or their pharmacist, right? The thing is that health information is out there and it's supposed to be helpful, but it should not completely substitute or take over and be the end all for your whole health journey, right? It shouldn't substitute you, for example. So if anyone have concerns or doubts, they should ask. If you don't ask, then you don't get an answer, right? So if you have a
Hmm.
question, do ask.
Gotcha. And how can digital health content, help patients become better prepared without encouraging them to self-diagnose or self-treat?
Yeah, so sometimes I think that health information helps people become less overwhelmed, so they can learn things on their own terms, on their own time. Because, like you mentioned, sometimes when they receive a diagnosis, for example, in the doctor's office or something like that, it's very overwhelming for them, and they're too scared at the moment to ask. They don't even know what this condition is. But when they go home, they learn about it on their own. Now they feel a little bit more confident and they know what they don't know so that they can ask the questions during their next visit. Um, like I mentioned, it should supplement their health journey, not completely replace it, replace their clinician.
Hmm. Um, how often, for example, in your field, I mean, I run into it a lot, but how often in your field do people come to you and tell you things about medications that, for example, they read about it online? A friend of them told them, Hey, I get this all the time about statin drugs. I mean, that's probably the biggest one that people um, come to me about. Obviously the muscle aches issue. If you look at the clinical data, it'll tell you about 1% of patients may have, the muscle side effects or the aches and pains. Whereas I think in clinical practice, it's probably about 40%, right? And there's a lot of people that complain about that. And so, um, how do you tell people to look at that, for example, and be able to alleviate their concern about taking a medication like that has good clinical data, that has good background, and be comfortable taking it despite what they're reading online?
No, I think that's a great question. So, I think one of the things that goes a long way is definitely don't completely dismiss what they are going through. It is at that moment their truth. That's what they're experiencing. So I do try to ask them some more questions to see what's going on. So, for example, if I notice going through their medication list, if they're taking simvastatin and amlodipine, for example, and the simvastatin is actually higher than 20 milligrams, maybe it is true. They are definitely experiencing muscle aches because of this interaction that happens. Sometimes maybe working with them to try to get their buy-in, like for example, saying, "Hey, why don't we switch you to another statin?" There's a little bit of data out there that says some statins are more fat soluble than others, so switching from one to the other may help. And of course, maybe just slowly, negotiating, right? And slowly helping them taper the medications, increasing the dose slowly over time.
Hmm.
That may help increase buy-in as well. That we're working with them.
Okay. Can you just take about 20 seconds and just tell people where they can find you and tell them a little bit about your pharmacy?
Yeah, sure. So they can definitely find me online. I work remotely. So you can find me on my website, which is Offscript. I think you have my website there. Thank you, with the word consults at the end, consults.com. Again, that's offscriptconsults.com. You can also find me on social media too. A lot of my social media handles is Ross, which is my first name, and underscore the word off script. So any social media accounts you can probably find me on. I'm definitely more active on LinkedIn, but if you want, you can definitely find me on Instagram, Facebook, Twitter, and Threads. So my Instagram is definitely vetted. So my Insta News and Insta Science is I definitely do my research if someone wants to go and try to find my content that way. And of course, you can always email me as well on my website. You can find my email there to reach out to me.
Great. All right. So what I really appreciate about this conversation is it gives people permission to be curious, but also careful. Online health information can be a starting point, but should never become the entire care plan. We're going to take a short break. We're going to come back, and we're going to close this conversation with personalized health consultations, career purposes in pharmacy, and how Roz is helping patients both professionally find more clarity. Stick with us. We'll be right back with more real stories, real breakthroughs, and real lives transformed.